there's a number of things going on, and right now, because of the move that the chamber has done in really pushing to reduce the GRT from 4.5 to from 5% to 4.5%, and really politically lobbying to keep it going to the 4% schedule for October this year. And that's very critical. And why do I say that? Well, we've all heard and read and we see social media posts of companies struggling, etc., the cost of living. You know, there was an interesting comment I heard, and I'm trying to get some stats, but from United Airlines, they have never seen more one-way tickets last year than they've ever seen on Guam for many, many years. And that says something. The cost of living is pretty high. So I have a few points I just really want to talk about. First, I just want to acknowledge the GYP, the Guam Young for Professionals, because they had an event about 2 weeks ago. They did it around the world. So if there's anybody under 40 years old, and I think all the women qualify for that here, at least under 30 maybe, but please, if you're interested. And why I mention them is because when we had the event, the GYP of the year, Professional of the Year, I saw a lot of energy. And what I did was I walked around and I made it very clear that they are the future. We've got a very important year this year: senatorial, gubernatorial, and congressional elections. If we are to make a change, it has to happen this year. Otherwise, we're going to be stuck in this rut. And so I encourage a lot of them to be able to be more active, to utilize them more effectively in everything that we try to do. The thing that really strikes me the most, and I'm concerned, and this is something that the chamber has been really pounding and making it very clear. I had a meeting with the largest contractors on this island. These guys are doing very, very well. But there was one consistent message that they gave me, was that we need to change how we do business within the next 3 to 5 years, because that cliff is going to come sooner than later. And if we don't act now, and we know it's going to take time to make changes, particularly how our government operates. And so that is the message that we're really going to be pushing out again this year. We had a delegate meeting with some of the senators who showed up just a week ago, and I impressed upon them a number of things, which was number one, keep course on the 4%, because you're not giving us something back, you're taking less away from us, and that's very important. So why 3 to 5 years? Because it's going to take that time. You know, when I sit down, and I don't know how many of you go visit Saipan, but I'm very impressed. It's economically depressed. But man, it's the cleanest, it's the cost of living is so much lower than here in Guam. And you've got a government that is working on really a very, very tight budget. We don't want to find ourselves in a position where we're caught with our guard down. So who we decide to bring in as our new governor, as our new senators, that's going to be very important. So one of the agendas for the chamber is we're going to start laying out a 5-year blueprint for every one of these political candidates to consider. And we want to approve it, so we hope to roll it out within the next month or so to the membership. And what's the agenda? Well, government efficiency, housing, workforce development, tourism. But these are going to be very action-oriented plans where we're going to lay it out for the next 3 to 5 years and set some targets. It's very important. And how are we going to do this? And because we're going to start laying the groundwork. And how we're going to do it now is when we start meeting with these candidates, and we're going to give you all the members, some talking points some very specific talking points to be able to have a discussion with them. And what are some of these talking points? Because, you know, it's so typical that when you ask a potential candidate a question, they'll know how to dance around it. Do you believe in efficiency? Oh, yes, I think efficiency is very important, etc. Okay, well, let's get straight down to the point. I'm going to give you some questions that we're looking to consider sending to all the gubernatorial camps. Number one, what are the top 3 actions you take in your list 100 days to make 4% rate sustainable? Very poignant. Another one, defining what does government efficiency mean in your administration? Name 3 measurable outcomes. For example, procurement cycle time, lapses reduced, overtime reduced. Will you implement position controls? No automatic recruiting vacancies. Each vacancy reviewed for redesign, digitization, consolidation. We're going to be very, very pointed in which they need to be able to tell us what they feel and what they believe. So when we go to the voting polls, we will know what they believe in. Here's another one, and this is for the gubernatorial candidates. Will you commit to an attrition plan? Reduce headcount over time without layoffs? And what functions would you prioritize for consolidation? And this is something that we all do in the private sector. We're constantly doing it all the time. So a few more. Would you require every major capital project to have a construction grade plan? In other words, scope, procurement path, timeline, milestones, and a responsible owner. We talk about accountability. We push accountability in our businesses. But will this be published publicly? And we talk about, when we hear about transparency, well then, let's be very transparent. Will you publish quarterly project delivery scorecards showing what was awarded, what is delayed, and why? Now we're talking accountability. Now we're talking to all the agencies. Here's one that's very interesting. Do you support a 20% CapEx asset renewal discipline, phased in if needed, so Guam stops rebuilding and then letting assets decay? Very, very poignant. And so these are just some of the many questions we've been gathering to be able to provide to all the candidates. And I haven't even hit the senatorial side yet. And we want to be able to share this with all of you, so we have these talking points. I'm giving a hint to all the camps out there that these questions are going to be coming, and if you want to talk to constituents, then you will have to answer these questions. So, from a senatorial standpoint, here's something that's interesting. Would you support a rule that temporary revenue cannot fund permanent payroll growth, so we don't blame the tax rate later? Very poignant. What metric will you use to judge whether government is doing more with what it has before asking taxpayers for more? Can we agree that the tax conversation should be tied to delivery outcomes, not promises? Now we're holding people to be very accountable. Which revenues are temporary, build-up related, and how are you preventing them from funding permanent costs? Very good, and they would have to come up with very straight answers. As well, would you require each agency to publish 3 metrics quarterly: cycle time, overtime, and lapses? And those are, here's again, with going to the 20%. Did you know that, and I cannot get the right figure, but we understand that payroll accounts for about 80 to 90% of our operating budget for these items. I can't confirm that. I'm hoping to try to get the true answer, but it always appears that that number is probably higher considering the decay of a lot of our government buildings and offices, and the delay of implementation, and the delay of digitalization, etc. with technology. I checked my friend Chad, GPT, and I compared it to Grok, And I asked, what are the lowest operating, the states that run most efficiently with the lowest operating costs compared to the overall budget? And those numbers came in between 20, 30, 40%. Okay, that makes some sense. All right, now, can we get there? Not overnight. That's where we're talking 3 to 5 years. Should we get there? I think we should be able to do it. You imagine if we reduce operating budgets by this government, they're asking for 1.4 billion. If we are able to reduce 140 million off of that budget, what we could do to help prepare this island from a tourism standpoint, to help support the cost of living, etc. You know, somebody, I don't know if a lot of you were around where I believe it was Joe Ada on the 5440 and everybody got a salary increase, but then everybody got a tax refund that year. Well, if you're having surpluses every year in the tune of 30, 50, 70 million dollars, what way can our residents benefit from helping reduce the cost by then giving some of that money back? Or maybe putting it into capital improvements. So the question is, would you support phasing to 20% as needed, but locking the direction now? And these are the hard questions. Now, how do we get there? So, you know, we're going to lay out this plan. We're going to lay out some talking points, but what's going to be most important is voter turnout. The voter turnout in the last election was pretty dismal. I believe it was maybe 50% or less. And I don't know why. But I encourage all of you to start having a discussion with your staff. Because if they don't go out and vote, all this talk means nothing. We can only do so much from the chamber side, and we can only be the voice, the very loud voice for our business community, and ultimately all the residents of this island. And so we want to be able to, one of the things we're going to do is roll out some sort of educational plan over the next several months to help all your businesses to have this discussion, whether you can send it to them via email, your staff, via email or whatnot. Most importantly, they need to be registered. If they're not registered, we can talk to Return Blue. Now, one last thing, because we got to get Mr. Campillo going before, the cartel comes and takes me away. This is a very delicate matter, and it's something very important. We're talking about membership fees. The chamber has not adjusted fees for the last 10 years. And the chamber, thanks to Ms. Catherine, has done everything she could to possibly control and reduce expenses, going from a high of 7 to 8 people down to 3. You cannot run the chamber with 3 people. It's impossible. So what we're looking to do is recommend some adjustments to the general membership. We would have to come before you all so we can have a vote to be able to approve this. Now, we're very cognizant because we've been pounding it's expensive to do business on Guam, it's expensive, etc. And the chamber doesn't want to be an advocate to adding that burden on all of you as a member. So what our treasurer, Kim Anderson-Young, is going to do is that she's laying out some plans on how to properly roll this out and implement it. But what we did to show the commitment from the board itself is that we had made a personal call for a personal contribution from the board members themselves. You know, as a commitment to show we want to delay or reduce any impact to the members. As a result, we raised over $9,000 for this effort that will go directly to the operations of the Guam Chamber. And I think for the members, my fellow board members, that deserves a round of applause to show them. So anyhow, that said, we have a lot to roll out for you by next month. We hopefully will have our budget all set, some sort of phase-in plan where it's going to be as equitable as possible, understanding the challenges we will face. And we'll look for a vote by next month. And please be on the lookout for our agenda for the next 5 years, a blueprint, as well as Okay, enough. I'm going to turn it over to Ms. Catherine now.
Thank you, Mr. Chair. Just very, very quickly, I know that many of you, and it has been mentioned, that the Guam Girl Scouts are here. I'm just going to say very few words, but they wanted to introduce the young entrepreneurs that we have here, and let's give them some time.
Thank you so much. I really appreciate you guys having us. I'm Samantha Owen, the director of Guam Girl Scouts, and we're proud to be members here at the Chamber. And I wanted to introduce Miss Laura. She's a troop leader. Tabitha is in Troop 360. Ari is in Troop 361, and Matilda is in Troop 362. So these are your future GYP members that are running their business right here, right now. So we really appreciate your support as they run their cookie business here today. Thank you so much. We do take credit cards.
Excellent. Thank you so much, Sam. Listen, before I introduce our speaker today, I just wanted to thank you, our members. Your commitment to the chamber. I mean, these are really, really tough times. I was walking around the room and talking to a lot of you, and you know that the challenges are very, very real. And so, we truly appreciate every dues payment. We truly appreciate the sponsorship checks that come in the mail and through ACH and your credit cards. It really, really means a lot to us. Your dues investment, your volunteer efforts in sharing your expertise and your talents, and your willingness to speak up and stand with us in support of private sector growth and well-being for our economy is crucial to the sustainability of our businesses and our communities. So your belief in the chamber is to stand for all Guam businesses, and I just wanted to say thank you. Our guest speaker is the President and CEO of Cabo Select Care, and has managed Select Care since the development of the health plan in 2000. With his team, they've achieved the objective of making Select Care the largest health plan in Guam and Micronesia, ensuring over 44,000 members. Our speaker also introduced the PPO delivery healthcare system to Guam, the prescription benefit managers programs, and the prescription mail order programs to Guam's consumers. Our speaker attended Los Angeles City College and UCLA. He received his managed healthcare designation from AHP, and his, I don't know what it is LUTCF designation from the National Association of Life Underwriters. Members and guests, please join me in welcoming our guest speaker, Frank Rivera.
Thank you, Catherine, and first of all, and thank you for the work that you do for the Chamber of Commerce with three people. I think we can start first with the Chamber of Commerce on how to manage companies with a very small budget. First, I'd like to thank all of you for being here today. Most importantly, thank those that are our insurers throughout these years and for the support that you have given us at Cabo Select Care. I'd like to thank the staff of Cabo Select Care that is here today. Please stand up if you could. Thank you very much and for all the support. We just finished a accreditation process, which, as those of you who have to go through that process, like GRMC has to, could become very stressful. We just finished that about a week and a half ago, and we've been reaccredited, so that's something that brings to you, our consumers, assurances that we handle your affairs at the highest level possible. I'd like to also, we didn't introduce the two individuals that are here, but we have some guests from GRMC here. We have Dr. Manaloto. Did he have to leave?
Oh, no, he'll be back.
Okay. And then we have Eric Plinsky and Charlotte here from GRMC. So they're not only our partners in healthcare, but also they are our insurers. Thank you very much for that. Okay. Mr. Chairman, I have bad news to report from the cartel side. We lost our leader in Mexico a couple of days ago. So it's over for me. Thank you. we're going to take this discussion today into 3 levels. Okay, the first level is we're going to talk about national global trends in healthcare, which I don't think it would be any discovery for us to realize that healthcare continues to grow across the world. We will then take you to the US, and that includes Guam, and then we're going to take you, the last part of the presentation will be specifically about Guam. Now, there is some numbers that will pop your eyes and that will make you realize that healthcare in Guam has risen for becoming the way it is and the strength that it is. So let's take it. We have somebody that's going to help me. As an introduction, Cabo Select Care has been around for about 25 years. We celebrated our 25th year last year. We actually, a little correction, Catherine, we actually run the insurance programs for 51,000 people across the islands, Palau, CNMI, and Guam. But in Guam, we have about 47,000 insurers. That means that we are about close to 27% of the population. If we take 154,000 as the number of population that we have in the island. Okay, so what is going on globally? Well, we have seen increase in healthcare expenditure. Global expenditures today are at around 10.3% of global GDP. That equates to about $11.2 trillion. The trend in the U.S. continues to be the largest. Again, today the President is speaking about the State of the Union, and part of the State of the Union will possibly be introducing a new alternative to the current health process that we have. Juan Carlos just came from DC in meetings at the White House, so like last year, at the end and the tail end of my presentation, he actually gave a little briefing on healthcare. So I hope that you bring us good news also from the White House. But what is causing that trend to increase? Prescription drugs have been the largest driver of increases across the world. For instance, referring back to our president, he continues to talk about my bad friend who called me from London and say, how is it that I have to pay $100 for this PAD medication here in England, but in New York I have to pay $1,300, and it's something that the administration and others are trying to see how we can control the price of prescription drugs because they continue to increase dramatically. We see more digital healthcare, again, telemedicine and digital healthcare that is replacing some of the healthcare providers. For instance, we see that it is stated that about a good 70% of the readings for MRI, CT scan, and Dr. Manaloto is back. Dr. Manaloto, foreign accountant, and he's the chief medical officer of GRMC. So Dr. Manaloto can actually concur or actually dispute my facts, but about 70% of the digital film, and digital film includes MRI, CT scans that are being read across the world, are now being read by AI. So the initial reading is AI read. So again, AI will be in our lives for all, but medicine will be probably one of the quickest to adapt to AI. We continue to see increased use in GLP-1s, again, the fat drugs that I just referred to, and I only use that term of endearment, not because I believe on the term, but our president uses it, so I'm just mimicking what the president says. Hopefully none of you get offended. We see that there is more generics coming to the market, and especially in the area that has been a key driver in the biologics, where we're beginning to see some biosimilars, but they're not coming to the market quick enough. If you look at generic drugs is basically a replacement. If you know the chemical component of a drug, it's very possible that anyone can duplicate that, and that's what generic drugs are, a duplication of the chemical of a pill. But pills and powder is a lot easier to duplicate than the new biologics, which is injectables, So not only the syringes have to pass FDA approval, but also the chemical in those, So that the pharmaceutical companies have become extremely smart. You know, we move from powder to liquid, but the liquid becomes more expensive, okay? We also see that the US has tried to move somewhat in the same way how other countries have medicine today. France and most of the world have what is called health boards that actually negotiate with the medical community in regards to rates, not only pharmaceuticals, but actually the applicability of medical rates across the nations. You know, so most of the European countries, with the exception, or even Switzerland has a little bit of a mixed match with that. You know, so most of the European countries, Japan, the rest of the Western world, the Eastern world, China, they basically have boards that tells you how much do you charge for medications, for medical services, and so forth, how much hospitals can charge. And we have tried to emulate that a little bit and tiptoe about getting into it by allowing Medicare, for instance, to negotiate with pharmaceuticals. Recently, we heard the president announce Trump RX, which I'll get into that a little more. You know, so there's tiptoeing into controlling costs in a way because it's gotten away from us, okay? And we also see a significant more of the care getting into outpatient care, which is a lot easier for us. Now, 20 minutes already, and this is the first slide, you know, so we're gonna move to the next slide real quickly. And some of the slides we are going to move rather quickly, some others we're going to come back to and be a little more thorough for the explanation. So we see this very easy to read for those that don't use glasses slide, how health expenditures per capita continue to increase. And it's interesting how you see blips, you know, you see countries like Turkey and you see countries like Korea. It's like, wow, why is healthcare expenditures increasing so much in those countries? Well, it's interesting. Turkey, for instance, has become a hub for cosmetic surgery, as it is Korea. As you know, Korea is a hub for cosmetic surgery. But you see that their expenditures are increasing dramatically as a result of that. Next, please. This shows the annual growth also of expenditures across nations. And again, this is just to give you a reference across the world, and then we'll come to Guam. Okay, next. Easier to read, you know, global health expenditures continue to grow. Again, we said earlier that we are at about $11.5 trillion, and it continues to increase. There is no, I wish I had been able to come here today and said, gee, we got a 50% reduction in cost of healthcare in Guam because GRMC decreased our rates by 75%. I cannot say that. So again, next slide, healthcare spending as a percentage of GDP continue to increase across the world and in every single nation. Next. And the trends continue to escalate. You know, you saw that there was a minor blip at around 2021, but after the pandemic, because people stopped going to see medical doctors, but during the pandemic, actually it accelerated. Why? Because, you know, we had to use new vaccines, new medical equipment, you know, to protect ourselves, you know, so, and it dipped a little bit again after the pandemic, but it just continues to increase and rapidly accelerated. Next. Yep. So this is a comparison on a per capita basis between the United States and the rest of the world. And Guam, we are in the United States. You'll see when we get to Guam that we're not far from being that green line that you see there. Okay. Next. Same information, places, and again, we display as to where we get this information from in every slide. These slides will be made available to you from the chamber later today or tomorrow. We'll send a PDF for this so you guys can download it. Okay. But again, you know, back to that slide, the U.S. continues to outpace every single country in the world. Next. Okay. And again, this is a different way of looking at how the world and how the cost of medicine and medical continues to increase across the world. Next. Another different way to view this. Okay, this is an interesting piece of information because this shows how we divide between public systems, private systems, and this is going to be important to you as we get to the end of the presentation. In fact, we were going to have a guest that couldn't make it today. He's engaged in something else, saving lives, but that guest was going to talk about something that we'll probably need to ask Juan Carlos in regards to the impact that the big beautiful bill will have in Medicaid and SNAP. Okay, next. Okay, again, this shows another graphical view of the world and how the U.S. outpaces everybody. Next. Next. This basically is a graphical explanation of how the expenditures are distributed across who pays for those, whether private health insurance, out-of-pocket expenses, and so forth. Next. Same, but in a different format, okay? And we're going to bypass the next one. As I said, there is some of the next one. We are now showing how telemedicine is beginning to increase and has actually increased dramatically since the pandemic. We see that telemedicine services can be a way to reduce not only costs, but also close the gaps. For instance, a lot of the mental health services are being provided to telemedicine today, and that is in a way that patients don't have to go anywhere. Patients who are a little bit scared of being seen, getting into a behavioral clinic, can do this from their home or their offices. Next. This now gets to costs, and it starts to show how the cost in healthcare is distributed across and who's paying for that, okay? So in regards to births, and we are showing this to you because you will be a little bit amazed to see that an average birth in the island is about $18,000 nowadays. It's about double than what it was about 5 years ago. Again, part of that you will see in a secondary slide that I will share with you. Next. This also shows that the rest of the world seem to have people in their hospitals for a lot longer than the US, but yet we are the most expensive system in the world. For instance, a mother in Japan is the maternity to deliver a baby is an average of about a week and a half to 2. Actually, there is almost mandatory 2 weeks in Japan for mothers to stay in the hospital. In the US, we actually do a very good job in getting mothers in and out of the hospital. The average in Guam is about 2 days, that helps, but the cost for giving birth is dramatically higher than the 2 weeks span that you have in Japan. So those are disparities that we need to find a way to how to bring them closer and bring those gaps. Next, we also shared with you how, for instance, the cost of a cardiovascular operation is in the continental United States versus the rest of the world. And as you can see, we're the most expensive when it comes to that. And we're going to bypass these next 2 slides for the purpose of moving the presentation along. Next, please. I wanted to get to this. So, the average premium in the continental United States is about close to $27,000 a day. And this is for average health plans that have about a $2,000 deductible. We're not even near that. Next, again, a different way to see this. Next, and next, please. This shows basically how firms are providing healthcare in continental United States. As you can see, employers who have over 200 employees, about 100% of them provide health insurance. That decreases as the number of employees decreases. So if we were to take this between employers of 25 and lower, the numbers will be significantly lower. Next. Okay, again, a different way to look at costs and how much premiums are being charged in the continental US. Next. Okay, and this is what I wanted to start getting to. So, now what? Okay, because that's exactly what we're here for, right? To see what our problems are and see how we can try to solve our problems. In our book of business, and again, we are 51,000 members, about 47,000 of them in Guam. The average premium in the last 5 years, and this includes 2025, The average premium for a single is $432 on a non-deductible plan. Most plans are non-deductible. About 85% of our plans that are being offered are non-deductible, are what's called first order benefit. Compare that now to what I just shared with you. Continental United States, where an average single is paying about $9,000 with a $2,000 deductible plan. So we are significantly lower, and in fact, it's interesting because we have a very large construction company that we insure here in the island, and their company in Hawaii called us, can you give us a quote for Hawaii? And part of that is because they see the cost in Hawaii versus the cost in Guam, and of course, we couldn't because we're not licensed in Hawaii. Next.
That
So
could
now-
change.
Hmm?
That could change under the Trump administration.
We'll bring you in a little bit on there. Okay. Next, now let's get specifically to the Guam system. We have 3 hospitals, GMH, GRMC, the Navy Hospital, about 90 clinics. Oh, and actually we're going to add a new clinic. Thank you, Soniara. Sagwa is reopening. As you can see, the building is being spruced up, and the SDA clinic is reopening there. Hopefully, they're able to do a outpatient burden center again. But the purpose that they have for the building is to bring more maternity care. That's one of the biggest problems that the island has had. In 2025, we had times where we only had about 2 OBGYNs in the island at a single time. Now, why is that a problem? The problem is because most of the OBGYNs were only focusing on OB, obstetrics, as opposed to gynecological. We're seeing a lot of problems and gaps in gynecological care, women going with long periods of not getting gynecological care, and that translating to farther, more critical care in the future. So we're glad that they're opening up their Sony. Congratulations, thank you. We also have, again, 70 clinics, not including dental and allied services, about 128 total medical doctors. But it's interesting, we have about 600 licensed doctors in Guam. And you will say, one second, we got 128 doctors in the island, but we have about 600 licensed. Yes, and part of that is the telemedicine that we talked about earlier. A lot of the hospitals, for instance, GMH is using for their NICU telemedicine doctors to be able to take care of the mothers. I'm sure GRMC uses some telemedicine for reading their MRI, CT scan. So we have about 600 medical doctors licensed in Guam, about 20 pharmacies, and then this reports a population, I said 160, but reading more updated numbers, about 154,000 people. Next. This, again, Guam, reported by the PDA last year in October 13, the medical inflation, over 15% in Guam, 15.7%. The average increase in the consumer price index was about 5.8, but just medical inflation alone, 15.7%, and that came back from a year where the year before was about 13%. So when you compound that, wow, we're seeing significant increases in healthcare. Okay, next. And this is where Eric Priestley came here because he said, I want to make sure that your numbers are correct. And I got a disclaimer to make these numbers are received or are obtained from what is called the American Hospital Directory. We don't make these numbers, it comes from the directory. All hospitals have an association and provide data to this association. And as you can see, for instance, GMH had about, and this is a very interesting number. Just think that between the 2 hospitals, we have $811 million in revenue. $811 million between GRMC and GMH. Now, GMH is showing us $289 million. The year before was showing at 245, so they went up by about 15%. Our good friends at GRMC was showing at 438. They went up about 32%. I'm sure that Eric may want to explain as to the reason of increasing those fees for us. But, and then we dive a little more into the numbers, and again, for the purpose of, next please, for the purpose of moving the presentation, I'm going to forgo a couple, but basically, GRMC is reported to have 136 available beds, with about 44,365 inpatient days during this report. By the way, is for 2024, the year ending 12/31/2024. Specialty care, they have about 14 beds with inpatient days of 4,018, for a total of hospitalizations of 150 beds, 48,000 inpatient days, okay? Next, and then, next. This shows, and we don't need to go into each and every single detail, the different specialties where, how the hospital divides the patient base and the income base for GRMC. Next. Then we go to GMH. They have about 138 available beds for routine services, about 33,977 patient days. Total hospital, 201 beds for 49,442. And they are a little more in inpatient days than GRMCs, yet GRMC very successfully had outpaced him with total revenue. Next. And this also shows the revenue a little more specific for GMH. They actually show a net income of $11,308,000 for 2024. Again, this is year ending, not fiscal year ending 2024, 12/31. And the next slide shows basically the different statistics for the different specialties that they handle people. But just imagine, two hospitals, $811 million that somebody has to provide that revenue to those hospitals. And that's only in hospital setting that we are spending that money on Guam. Next, okay, sorry. And this is where we're going to give you a little more of the focus of our talk today. And again, the intent of this talk is not to disparage anyone. It's not to say that we're worse or better than anybody else. In fact, I commend the medical community in the island for the work that they do. They do an incredible job at saving lives in many ways without having all the resources available that you will have in a regular hospital in continental U.S., without having all the specialties that you will have in Manila or in Jakarta or Japan or any place in continental United States. So I commend the community. But this is a little bit of a picture of where we are. We have about 51,000 members. Of the 51,000 members, 54% are just single, the actual employees. 31% is with children and the youth. 14% of that is spouses, and 1% is domestic partners. Next. As you can see, our population is aging, and it's not only aging, but also we have seen, as the chairman said, not only our population is aging, but also we are seeing an exodus in our population. As he mentioned earlier, that United has not sold as many one-way tickets as this past year. And we break this population down for you, the population that we serve. Since we serve about a good 27%, we can translate this into the rest of what is happening in the community on Guam. Next. We also break down for you as to how our members are using healthcare. We have about 2.81 visits per member a year. So 51,000 members times 2.81. So we have about a good 130-some thousand doctor's visits per year. About 292 visits per 1,000 members to the emergency room. About 69.7 hospital admits per 1,000 members, and about 41 preventive visits per member. So that's bringing the population, and you can again transport these numbers and enhance it into the overall population. Next. What is driving healthcare in our community? Well, we see, again, if you see the areas that are opening up, we see chronic kidney problems, and that chronic kidney problems are compounded by cardiovascular issues. And then number 3 there, which is diabetics. All of this relates kidney issues are mainly related to diabetes. We have cancer as a significant driver, the number 4 driver in our community. Sepsis, which is basically acquired mainly sepsis is sorry, I'm having a brain fart on that. But sepsis is a condition where individuals, mainly when they're hospitalized, doc, help me here. The whole body becomes.
It's a multi-organ systemic inflammatory.
Exactly. Thank you, doc. And then we also show you where our population is getting care. As you can see, about 83% of the care stays in Guam, 8% goes to the mainland, about 4%. Despite the fact that we see a lot of people going to the Philippines, about 4% are going to the Philippines, and then about 1% are our neighbors in the CNY. Okay, next. We transport this to now pharmaceuticals, and this is to basically bring it together between medicine and pharmaceuticals. And as you can see there, pharmaceuticals tell you the same story. Next is basically diabetics, cardiovascular issues, blood clots, asthma. Number 4, diabetic supplies. So our population again has a significant problem with diabetes, cardiovascular issues. So this is just to relate the drug side to the medicine side. Next, it's a different way to again show this, but again it relates what is happening in our community for diabetes. The next one shows you the top therapeutic classes for which we're spending money on, and as you can see, GLP-1s. GLP-1s are drugs that are specifically for type 2 diabetics, but they have become extremely popular across the world because the side effect of GLP-1s is that people reduce or lose weight. We still don't have full side effects. A lot of people are beginning to use this and this more for weight loss, weight management, and we're beginning to see companies that are offering GLP-1s as a benefit, but again, this is something that is added. We only cover GLP-1s for the specific purpose by which the FDA designed these or approved these drugs, and it's to treat type 2 diabetics. There is a couple of drugs like Wegovy that is also approved to treat cardiovascular issues. So if you are part of that group, we also approve that. And there is one more that was approved for GLP-1 that was approved for sleep apnea. And it makes a lot of sense. For instance, if you're heavy set, it's very likely that you're going to have cardiovascular issues. If you're heavy set, it's very likely that you're going to have sleep apnea. So it makes sense that some of these drugs are actually being approved for other services. But the problem with these approvals is that it's increasing the cost of medical care at an accelerated pace. Next. Again, so this shows the picture in a different way, but it's showing you where our diseases are. Next, we're going to bypass this. I'm going to bypass this area of GLP-1s. Next. And for the purpose of getting next, please. We'll share this briefing with you. Back. Thank you. Okay, we wanted to split this because this is where Dr. Nori, that was supposed to be here, was going to talk to you about the concern that the community will have. There are some changes in the big, beautiful bill. As you can see, the payer mix for GMH, and this is statistics from 2023, about a good over 60% of the population that was being treated at GMH are Medicaid and Medicare individuals. Medicaid is going to have a significant change with this big, beautiful bill. We have about 41,000 people in Medicaid in the island, 41,000 people. So a good 26%, 25% of the population in Medicaid. Medicaid is going to require that those individuals, it's a good solution. I think President Clinton at one point tried to implement that too, is that you have to show that you're trying to get work. You have to show, or you have to provide community services to be able to continue to be in Medicaid. And you have to prove this on a quarterly basis.
Age too. It's age structure.
Is age structure as well, you know.
So it's not, you're not 80 and we're gonna make you have to go and find a job.
Exactly, you know, so like for instance, Juan Carlos won't have to go and prove that he's eligible for Medicaid. But structurally, we have some doctors that have come to us and told us already that they have concerns with us, you know, because, so 41,000, this, if we were to translate that graph that I showed earlier, you know, about half of the population would be about less than 50. And so that will mean about 20,500 of those that will probably have to require to show work. If we, at the Chamber of Commerce, and all the companies that are for the Chamber of Commerce became so successful that we had to employ a lot of employees in 26 and 27, I would assume that, and I would possibly put a bet on that we won't be able to create 5,000 new jobs in the next year here in the island. So that's the critical reason why they are concerned that some people may lose Medicaid. Now, I know that the congressman and I know that Juan Carlos are making or trying to make the routes to DC and see how we can get some waivers on that. But it's not the only benefit that is going to be changing. Also, the SNAP benefit, we have about another 41,000 people in the SNAP benefits that also.
But the Medicaid is, you need to show that you're actively looking to try to get hired. You don't have to be hired. You need to be working to get hired.
Correct.
Because we realize that the economy is sort of hurting and some people are not gonna find jobs.
Correct.
I think the idea is those that were not looking to be hired, just sitting there and decided to take themselves out of the workforce.
Correct.
Which in Guam is a substantial number of the workforce population.
Correct. Yeah. So the concern is how will that impact the Guam Treasury when already we're saying that there is some say that is impacted, you know. So okay. Now, so what are we looking into the future? Yes, sir.
Governor Campbell. Governor Campbell has a question.
Oh.
You know, recently the Medicaid was allowed for compact citizens, right?
Mhm.
Has there been any change in that? There's, mass migration. Okay, so continuation.
They still qualify.
Okay.
They're working on whether they're gonna provide transportation or not. Because the cost of transportation is not included. So they need to still move themselves from their COFA states to here to get those benefits. They can go anywhere in the United States, but we're sort of the closest target. But at this point, they're still working who's gonna pay for the transportation costs. So the transportation cost presently is a personal expenditure.
Yeah. And if you recall, Governor, we were allowed to now integrate the other states, the Micronesian states, into the Medicaid system in Guam. Before they were into the MIP system, and they were allowed by the Compact Association Agreement to be included in that. But if that gets cut, for instance, that you're going to see a cliff, and that cliff is closer than what we anticipate. So what are we going to see in the future? Well, and what can we recommend to you guys? Okay, well, I think it's time to look at plans for deductibles to mitigate cost increases. We have a very active wellness coordination in trying to get people into better health. Clearly, the fact that we have such huge population with diabetes, and we're the #1 in the nation, by the way, diabetes, and we're #1 in the nation in obesity. So we have something that we can reverse. Clearly, the food that we intake is not necessarily the best for us, but it's one of the best tasting foods in the world. So that's a very difficult choice for all of us, but we can control our destiny and control some things in the future to control costs. And that is, yes, if we're able to reduce weight, if we're able to implement some changes in health costs and sharing that with the members. For instance, many of you are concerned about deductibles, but every single plan that has a deductible allows the employee to still continue getting preventive services without paying a deductible. So the deductible are for catastrophic cases or catastrophic issues. People don't go bankrupt for preventive services, they go bankrupt for catastrophic services. So if we're smart, we're able to develop plans that will be more acceptable, more economically feasible as we continue to go through these challenges of the future.
Stop smoking. Smoking.
The island also has a very high number of smokers, and that's the reason why we have such a high levels of cancers. But we also, the cardiovascular issue implies to high blood pressure. We also have a significant number of cases that are end up with aneurysms and with blood clots and all of these things that GRMC takes good care of us, for the $522 million that the population pays. Okay, so it's a lot to digest. I know that we don't have a cure for the future. Now, what is going on with potential policies in Washington? Again, President Trump came out with something that is called Trump RX. It's a way to provide discounted medications, but that discount medication only applies to individuals who do not have health insurance and do not have any other means to pay. So the population is relatively small. They will continue to press very hard in regards to negotiating with the drug companies. He's apparently trying to get the Most Favored Nations Act, which means that they will charge us the least amount that they charge, pharmaceuticals will charge the least amount that they will charge to countries in the world, so we'll see how that goes. I know that they've been looking at replacing the ACA. That was something that they talked about in the first administration of the president, and they couldn't get there, and they're talking again now. But we had to make some changes. Part of the changes that we have made actually has not helped us. For instance, tariffs have not necessarily helped either in the cost of medicine. This hospital, for instance, has to bring and import things from other countries, and if those China and Korea were producing significant amount of medical equipment, but if now the medical equipment becomes more expensive because of tariffs, then it doesn't help us. So we have a world that seems to be, in one way, we want to reduce costs, in another way, we're not able to reduce costs. Again, the cost of every manufacturer in America, including the automobile companies in America, they are paying an average of about $5,000 per employee related to medical expenses versus when you compare to China, it's about $1,500. So you have those disparities. How do we close those disparities? I'm sorry, I'm not the genie that came out of the bottle to find a cure, but we are able to shape for you plans that will be able to mitigate the cost increases as we have seen throughout the island and throughout the United States. And I'll be happy, it's a long presentation. Healthcare is very engaging, a lot of information to having 45 minutes, plus we needed to include the cartel news. I'll be happy to take any questions that you may have.
Thank you. I know you said that Juan Carlos will have the answer to this, but we have a lot of veterans on our island. Do you think that if we can engage our veterans to get their benefits, where the federal government will allow the veterans to have more coverage and get it paid for by the federal government, or potentially get Congress or some folks to maybe bring a VA hospital for our veterans here and for the people in the region that are veterans, so that they can come here. Not to mention the folks in the foreign medical program in Philippines, Japan, Korea, Thailand, and the Asian region. Would that try to help us with a lot of the things that we're experiencing right now? If the federal government comes in, takes care of our veterans, we get all our veterans to come in and get their care from the VA, and maybe lean on that so that we can reduce some of the pressures that are happening to a lot of the folks here on our island. And we could ask you to be the ones to help us build that hospital.
Well, I know that we're trying to lobby, but I'm going to yield and see what, Juan Carlos just came from 3 days of meetings in DC at the White House, so maybe he can give us some good news.
Thank you.
So the veteran issue is an issue I care a lot. I am not a veteran, but my father was one, and also is my uncle and my father-in-law were. So the biggest issue for us is getting the veterans that are on island to register into the medical veteran system. We estimate between 23,000 to, at the low number, 14,000 veterans on island. The register on the program, around 7,000. And when the veteran service is to determine how to provide services, they're looking at the population that is needing their assistance. Now, why are so low numbers? Hey, if I have a second job and I'm working in a private provider and he's providing a great college select care, why would I use the veteran program? So I'm not going through those services until I get into a major crisis situation, and then I try to get there. That's our problem. I really honestly don't care if they ever use the service. I just need them to register. And that needs to be a concerted effort by the chamber, by the local government, by our legislature, and our congressmen. We all together need to convince them to do that. If we reach the threshold, there is support in Congress to try to do more here. But that's not going to happen unless we're able to prove to them that what we're saying is true. The second part is we need to count not only on the veterans that are here, but the veterans that are in the Northern Mariana Islands and the COFA states, because we should look ourselves as a veteran region. A lot of those services are going to the Philippines. That clinic closed the other day. I don't know if you guys know that it's being shut down. The Philippines, they're talked about reopening. But it would be a lot better if that clinic would be here, at least if you ask me, to service those COFA states as well as serving us. So that would be my thing. It's a joint effort. I'm always glad to work and assist with you guys. It's dear to my heart.
Awesome, thank you.
The chamber supports any initiatives, especially also remember, we also have technically a reduced number of medical providers in the island. And that's another gap that we have, veterans not being able to see doctors on a timely basis. And I know that the medical community is working on a potential, the administration and the medical community on a potential change to the licensing law, so we can bring more physicians without having to be too tight in the requirements. So many of the physicians from the Philippines will probably qualify if we were able to make that change. But Eric, you wanted to make a comment?
Yes, thanks Frank. Eric Plinsky with GRMC. I want to first talk to my friend here about the issue of a Veterans Hospital needing to be built. That I absolutely disagree. Guam Regional Medical Center is the Veterans Hospital. We can handle anything. We're licensed with all VA, TRICARE, so we just need you to come by. We've added all the specialties. The only thing that we're probably, I know we're not there to be able to help with is mental health. Okay, that is something that's a challenge island-wide, and I think Guam Behavioral Health is unable to keep up with the demand there, so that is an issue. Frank, can we bring up that slide that you keep referencing of the $800 million, 500 million of which are GRMC? I got to clarify, I knew I had to come to this meeting. Sure. So the thing is, the law states that when you're paying Guam Memorial Hospital, you must pay them the billed charge. That would be gross revenue, but not for the private hospital. That involves negotiations with the private plans. And what do they pay us? Half the billed charge, about all of them. So we need to divide 522 in half. We're being paid less than GMH. I can see and on top of that, we did not raise the rates at Guam Regional Medical City, any of the private plans for 2 years. So we absorbed the supply chain costs, the tariffs, all of that. So all those increases you gave them were not from us, but we got to change that this year, unfortunately. So we're really about, what is that, 250 million is really the real number that we need to be looking at.
It's just total revenue, and that again is what is reported in on.
Right, but net patients, no one pays us billed charges at GRMC. It's all negotiated rates. Cut it in half, but at GMH, paid billed charges is what they get paid. So that's a dramatic difference of how the two hospitals are paid.
Yeah, and again, my topic was not to disparage any organization on the island. We're very thankful for the work again that all the providers in the island do. It's just a perspective of cost. For instance, we'll talk about the U.S. being about 18% of GDP. Well, if we are $811 million just in hospital costs, and we integrate the rest of the medical services, for outpatient services and so forth, we will be possibly, in my opinion, we're a little bit ahead of the 18% of GDP of the one domestic product in regards to medical expenses. And again, let's not say that it's bad. By the way, GRMC, let's talk about GRMC. They've been not only a great community partner in regards to providing medical care, but also they've been a great employer, you know. So just because you are 18% of GDP, that doesn't necessarily mean bad, because that also means that you're creating jobs as an entity, you know. So thank you, Eric.
I appreciate the slide. You said 80-some% are staying on island. That is great news. I had no idea that much healthcare is remaining on Guam.
Yeah, because what goes out is the critical care, you know, the higher specialized, you know. Since you guys came on board, you know, a lot more of the care is staying in the island, you know. So, but it's not meant to say that you bag the wolves, you know. So we wish you can give us more discounts, yes, so we can give them to the rest of our members in here. But you're a good partner in the community. Thank you. Anybody else? Well, no more questions. Thank you very much. Have a happy afternoon.
Okay, I just want to say I really appreciate Frank coming up here and giving us a lot of information. More importantly for me, I discovered I got to see an optometrist because I failed the eye exam in which he administered to the side. So thank you, Frank. I really appreciate it. If there are no other matters,